Well, hello everyone from a chilly day and the COP26 hosts in Scotland. My name is Rob Lawson, Chair of the British Society of Lifestyle Medicine and Chair of the World Lifestyle Medicine Council. Thank you, Dr. Shagufta Feroz and the officers of the Pakistan Association of Lifestyle Medicine for this invitation to say a few words in honour of our inaugural international conference in 2021. In recent times, the spotlight has been shone on the health of our respective nations, and the true scale of our determinants of ill health is being exposed to a wider audience and even to our governments. The COVID pandemic is shocking, not only for the bereaved and infected, but to a lesser degree by every citizen in our countries. We mustn't walk out of this pandemic unchanged. At an individual level, community level, societal level, we have to make hard choices and accept that in this Anthropocene era, mankind has created the conditions for this perfect storm of acute and chronic disease. We have presided over the degradation of our individual and planetary health, and we're exposing our children socioeconomically and environmentally to the prospect of a lesser healthy lifespan than their parents. So it is really the time for nudging that hashtag one change at a time. As Professor Gary Egger told us in a recent broadcast, whereas education and motivation are key factors, regulation and legislation must surely follow. Now, we don't practice lifestyle medicine for fame and fortune. It's not alternative, and there's nothing whatsoever to do with apportioning individual blame. People are people, not conditions, and are not being judged. It is us who have created this unhealthy environment, for some more than others. We must now uncreate it. Lifestyle medicine is rooted in science. Almost every guideline tells us this, and applying its principles is key to our future global health. Another part of the solution lies within our own societies. The Pakistan Association of Lifestyle Medicine is showing leadership in your country and is to be applauded for that. In the British Society of Lifestyle Medicine, we have a community and network of supportive individuals who really care, who want to make a difference, who want to bring change to bear. It provides educational opportunities which help to remove barriers to change, most of which are related to confidence and perceived competence amongst healthcare workers. These educational opportunities do include certification from the International Board of Lifestyle Medicine, and the best of luck to all the candidates at this year's exam. The development of our BSLM Learning Academy is a current priority and is gaining fast momentum, such that we will be opening up quality content early in 2022. So together, the World Lifestyle Medicine community will be the driver for change, which will turn the tide of avoidable premature death and the non-communicable diseases lapping on our shores and at our borders. And thereby, we will mitigate the damage of any future inevitable syndemic. At World Lifestyle Medicine Council level, our vision statement is this: a world where all citizens can achieve optimal health in an equitable world without non-communicable disease. Ladies and gentlemen, I've shown no slides, no graphs, quoted no statistics, and used only the spoken word. But the message is clear. In the midst of the rising global burden of disease, together we can make a difference. We can address what really matters to our patients and our citizens. And so I finish by congratulating PALM for your inaugural conference and all the delegates for having the wisdom to participate in a very important development in your country. And I'm sure you'll be inspired. Wishing you all well and take care. Thank you and have fun.
Assalamu alaikum. My name is Dr. Mariam Azhar, and it's my singular pleasure to talk about the effect of lifestyle modification on my life. I started lifestyle modification program under the guidance of Dr. Shagufta Feroz in 2005, and I've never looked back. When I began with her, I suffered from a chronic case of psoriasis, both plaque and guttate. It would cover around 80 to 90% of my body. I'd also recently, at the time, developed cough variant asthma. And my body used to remain very cold, something that I recognize now as a symptom of very low immunity. Suffice it to say, it has altered my life, my family's life. It is truly a modified lifestyle in which you never want to go back to old ways. And we as a family were people who used to eat clean, would not engage in eating habits that would be generally considered awful. So understanding the timings of food, the importance of deep sleep, the importance of timings, the importance of having breakfast early. I remember my friends making fun of me that I have dinner for breakfast. And that really changed my life, ensuring and having knowledge of your body, of the fact that your body is a wise organ in and of itself, that there is some wisdom, innate wisdom, that will tell you whether you're doing the right thing or the wrong thing. And it is beautiful when you get to know it. And there's no turning back. And cheat days don't feel great anymore because you feel you don't enjoy later on in any case. So it is indeed a beautiful journey of lifestyle modification in and of itself. Is a beautiful journey of getting to know yourself, your food requirements, your body type, the wisdom innate in your body, and your emotional health as well. It is a complete package, and I'd urge anyone who is so inclined to move towards it and see how it transforms our existence, both emotional, physical, and spiritual. Thank you, and best of luck for this journey. Khuda Hafiz.
Assalamu alaikum everyone. This is Dr. Sana Noor, working as Assistant Professor in Department of Community Medicine, Avasana Medical College, Lahore. Recently, I have done my lifestyle medication course with Dr. Shagufta and her competitive faculty, and which I really enjoyed a lot because this course has changed my perspective towards treating the patient, caring the patient, healing the patient, which is really much joyful journey for me, because as being a practitioner which is based on conventional medicine, and when we heard her, when we listened, me, for my family, and definitely for my patients, in which I'm going to give the advices based on lifestyle medication courses, this course, and that is really going to give me the results which were never expected by only the use of conventional medicine, 100%, that's for sure. So I am really blessed to be the part of this lifestyle medicine course, and I shall remain thankful for Dr. Shagufta for giving us so much knowledge, so much love, with so much love and affection that we are.
Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Amreen Tahir, and I am a student of lifestyle medicine. My journey of lifestyle medicine began perhaps back in 2016 when my husband was diagnosed with a critical disease in his left coronary artery during a routine medical checkup. It was obviously a nightmare for us, and doctors were insisting for angioplasty, but my husband was determined to try lifestyle changes as a priority. So we started it. We did huge modifications in diet and physical activity. Other modalities like sleep and social connectedness were already fairly good enough, though we did not know them as pillars of lifestyle medicine at that time. Anyhow, we succeeded, alhamdulillah, and that is how my journey of lifestyle medicine began. Last year, when I heard about the certification course by Dr. Shagufta Feroz, I opted for it immediately, and it has transitioned my random ideas and knowledge about lifestyle medicine into very organized and scientific ones. I feel very empowered positively, and I have become very calm emotionally as well, and my overall health status has also improved very much since then. To add on, I have also started an international course of lifestyle medicine, and I'm very eager to use my knowledge about lifestyle medicine in my field in future, inshallah.
Hi, my name is Dr. Lisa Schuler, and I will be presenting at the upcoming International Lifestyle Medicine Conference. I'm very happy to be part of this conference, and I will be talking about some diet and nutrition related strategies to reduce the risk of breast cancer and reduce the risk of its recurrence. I'm very passionate about this topic. I'm excited about this topic. There has been a lot of research findings over the last decades that have consolidated our knowledge in this area, and it's quite possible now to provide evidence-based recommendations that will, in fact, reduce the incidence of breast cancer as well as reduce the risk of its recurrence. So I'll be going through some data on the impact of obesity. I'll be talking about very specific findings related to macronutrients, so talking about fiber and fat and protein, and of course the very important role that vegetables play in some of the phytonutrients in vegetables, and some other topics. So we'll get into it in a way that will hopefully leave you with a very clear set of guidelines for you to apply in your clinical practices. So hope to see you there.
Hi, I am Dr. Tamami Shirai. This December, I will be explaining how Japan has achieved atypical longevity at the conference. Today, the average Japanese woman lives to age 87.74 years, and the average Japanese man to 81.64 years. However, in 1947, Japanese woman lived only 54 years, and a Japanese man only 50 years. In the 1960s, Japan's stroke rate was the highest on the world. How did Japan achieve this longevity miracle in only 75 years? This is the subject of my talk. If Japan can do it, other countries can do it too. See you in December.
Assalamu alaikum. My name is Mohammad Zia Abbas. I'm an MD. I came to know about lifestyle medicine and I joined this course. Before I joined lifestyle medicine, my concepts were treating patient and treating not rather the patient, but the illness that they come for. The conventional medicine was right up here in the head, and approach towards patient treatment was very different. Ever since I joined lifestyle medicine, first of all, I tried to bring some changes in myself, especially in my mindset. What changed in my thought process was about that disease can be reversed. This was something very new for me, that disease could be reversed. Going on and learning more day by day about lifestyle medicine, because it's a very vast field and it tried to cure not the disease but look at the patient as a whole and try to have a broader approach towards curing that patient. I try to implement things first of all on myself and try to see what changes I could bring in my life. First was a positive approach and positive mindset, which was a positive thing I got. And moving on, then the clinical issues that I was facing were improving day by day when I really started practicing this. Moving forward, I try to gradually implement and incorporate this into my normal clinical practices. And the feedback I started getting from my patient was amazing. They were all very optimistic. They came back and they kept on asking me those specific tips about lifestyle changes. Overall, if in a nutshell, lifestyle is really life-changing thing. Thank you.